we're PHSA, and we're presenting the Casa Ley Public Health Department book read event. Oh, my slides. Hold on, give me 1 second. Okay, so just a quick intro about PHSA. So our mission statement, so we just aim to provide public health students opportunities to obtain career-based opportunities to grow personally and professionally. And we also advocate for the needs of the students in the public health department for their education, and we just create an outlet for networking and volunteer opportunities.
Hi everyone, I'm Rochelle. I'm the Director of Finance for this year's Executive Board. Here on the slide, we'll just go over and briefly introduce each one of the board members. So for President, we have Joanne. For Vice President, we have Brenda. Our Director of Internal Affairs, we have Daisy. We have our Director of Media Marketing, Charlie. And lastly, we have our graduate student liaison, Morgan.
Hi, everybody. I'm Naomi. I'm one of the cohorts for the spring 2023 term. We have 5, which are Waldy, Pamela, Marco, and Nestor. It's nice to meet you all.
Hi everyone, I'm Daisy, the Director of Internal Affairs, and this is Dr. KP and Athena, our wonderful PHSA advisors who so generously keep the PHSA e-board and co-chairs on top of our game. We all look forward to this year's book read and are so excited to share the following trailer with you all.
So before we get to the trailer, we just want to introduce the book. I'm pretty sure you guys all got it already. Lifelines by Dr. Leana Wen. So we made like a little cute trailer to promote the book and our book club. So we hope you guys enjoy it. Oh, I'm so sorry. Public health is all around us.
It's the air that we breathe, the water that we drink, and the communities that surround us.
Every day, public health faces new challenges.
Whether it's maternal mortality, opioid overdoses, or COVID-19, public health faces a daunting set of tasks.
And public health leaders are tackling those challenges with grit and determination.
We are the next generation of public health professionals, and we can learn a lot through these experiences.
This semester, our department is hosting a department-wide read of the book Lifelines by Dr. Leana Wen. It is a story about her evolution into one of our nation's foremost public health leaders.
It is a book club of sorts, and we would love for you to be part of it.
I would love to see actually paying attention to the social determinants of health and not just giving lip service to it. And I would also love to see adequate funding for public health. I mean, so that local public health isn't always about robbing Peter to pay Paul, which is what it feels like all the time, that whenever there's an emergency, you cut from something else in order to work on this new emergency, but all these other things that were crises before get left by the wayside. And so I would love to see that.
What we're doing is truly unique. Over the next several months, we'll have many opportunities for you to participate in open conversations about the book. Even better, we're hosting a series of events about public health leadership that help to bring this book to life. This includes a visit from Dr. Wen herself in April. So please read as much of the book as you can, and then join us for as many of the activities as you can fit into your schedule. We'll see you there.
Okay, Dr. Stevens, you want to take it away from here?
I'd be glad to, but I gotta say, first of all, that video is just so beautiful and exciting to watch. Thank you, PHSA, for putting that together. It makes me excited about this whole book read process, and to know that so many of us are going to be engaged in that process. If we could, I think just maybe someone from PHA could help me work on this, just pinning myself and the speaker, Dr. Chanyasulkit, in just a minute, so that we can see everybody. But let me just say a few more thank yous. First of all, to PHSA, and second to Dr. Zellman, our department chair, for supporting this idea of the book read, and really all of the faculty at our department who've been supportive and let me crash their classrooms in the past couple of weeks to introduce this book read over and over again and to pass out copies of the book. And let me just welcome, all of the students that are here for this event. I'm really thrilled that you're going to be a part of this, and I hope you find this whole process to be exciting and rewarding. Let me tell you what we're doing. This is our second year doing this book read event. Last year the faculty selected a book called Healthcare Revolt, written by Dr. Michael Fine. And this was essentially a manifesto of sorts for fixing our healthcare system. We held a series of events in support of that book read. And if you didn't get to participate last year, you can actually watch the visit from Dr. Fine at our department's YouTube page. Now, the purpose of this book read is to unite around a valuable public health topic and to really try to create a sense of solidarity among the students and the faculty. By doing so, this year we're reading Lifelines by Dr. Leana Wen. It's the story of her transformation from an emergency medicine physician into a public health leader. Our department purchased and distributed more than 500 copies to our undergraduate and graduate students and all of our adjunct faculty. And so most of you should have a copy by now, but if you don't, you can still stop by the department's office on the 3rd floor of Simpson Tower to pick one up. Now, what I think makes this book read special is that, first of all, we're reading an important book about public health leadership, and it's written by a person who's been tested and challenged by a number of public health threats. We don't have to agree with all of her ideas, but we can certainly learn from her experiences. Second, I believe we're the only public health undergraduate program in the nation that has done something like this in public health, and we're building quite a reputation for doing it. And maybe most importantly, we're embracing this idea of learning beyond the classroom. Our faculty, we all know humbly that learning really only starts in the classroom, but it's your experiences and it's your pursuits outside of it where most of your intellectual growth is going to occur. And so as part of this book read, we're holding a series of events to bring the book to life. And the theme of this year's book is really about public health leadership. So for our kickoff event today, I'm thrilled that we have Dr. Chanyasulkit joining us. Chris Chanyasulkit is the current president of the American Public Health Association. And I believe she's the youngest in the organization's more than 150-year history. Beyond that, she holds leadership positions with local, state, regional, and national governments and civic organizations working to promote racial, gender, and health equity. She served as a gubernatorial appointee with the Massachusetts Asian American Commission and also the Commission on the Status of Women, where she's advocated for the needs of Asian Americans and women throughout the Commonwealth of Massachusetts. Dr. Chanyasulkit, she served as a human services specialist and assistant director of diversity in the town of Brookline, Massachusetts, where she lives, in their Office of Diversity, Inclusion, and Community Relations. She's designed and delivered graduate public health courses at the Simmons University Department of Public Health, and she serves as an adjunct assistant professor at Temple University, where she teaches public health advocacy, perfect, in the College of Public Health. Turns out she's also a big fan of reading and even serves as an elected library trustee of the Public Libraries of Brooklyn. So for our efforts here at Cal State LA, this couldn't be a better match and a better way to start this book read series of events. I'm really excited to get into conversation with her. So if we could find some way to all virtually welcome Dr. Chanyasulkit.
Hi. Can you hear me all okay? So I want to apologize in advance. I sound a little, and I have hoarse because I had COVID. but I am on day 5 and finally testing negative, and thankful for vaccines and science and masking, because I'm trying to keep it away from my 3 little kids, so as not to ruin their February school vacation week. So let's just say we are masking and quarantining and all those good things. So I apologize in advance if I cough. I'll try to mute. But hello. Oh my goodness. So before anything else, that was a freaking awesome trailer. You all are just, so if you're not APHA members yet, I'm looking forward to you being so, especially since we have great discounts for students, and already like the future is bright with you in it. So I'm really excited, honored, and thankful to be here. So thank you.
Yeah, welcome, and you sound just fine. So you're hiding the COVID experience very impressively. I'd love this to be a conversation, and I just want to give everybody a heads up that this will be between Dr. Chanyasulkit and myself for maybe 35 or 40 minutes, but then we're going to open up some space for everybody to dialogue with Dr. Chanyasulkit. So save your questions and be ready to pose them at the end, and I'll give everybody a little warning when we're getting close to that time period. But maybe I could start with this. We've met and talked previously, and you told me that you came to leadership somewhat unexpectedly. And I thought the story that you recounted to me was really just fascinating, and also just really motivating to hear. Would you mind just telling us your story you got into it?
Sure. So I am a first generation Asian American, and my parents, they were working all their full-time jobs, and I was just home alone at night because childcare wasn't a thing back in the day. And I would do a lot of reading and watching TV. And little did I know that not all families were like the Cosby Show and everything else that I would see on TV. So, my job, my parents would reinforce, was to go to school and get good grades and like keep your head down, and just like that was my thing. And I get it. And I was supposed to be a surgeon, preferably, who would then go back to my parents' country in Thailand and somehow save everyone and give free surgeries, and that's what my plan was according to my parents. So I studied and I just did these things, but I never thought about leadership. It was just, do your work, get straight A's, as much as you're not cut out for getting some straight A's, and physics is not my forte. So I will just share that. And organic chemistry, it still kind of haunts me. So, I didn't ever expect to be, let alone president of the American Public Health Association, but ever in a situation where we would stand up and talk in front of people, be a leader, to organize things, to move strategies forward, to advocate, to speak at our state house. And it sort of happened because I realized over time that I am thankful to have the opportunity to speak out, in particular for a lot of my relatives and family who don't even speak English as a first language, and some who still don't speak English, to be there advocating for others who can't, to be a voice for those who can't for whatever number of reasons. And then I started to realize, like, okay, it's really, public speaking makes me nervous, sweaty. This whole leadership thing is kind of stressful, but as I do it little by little, it's a little bit less nerve-wracking. And what's really inspiring is when you can be a small part of a big change, to know that maybe you spoke up and gave testimony at the State House. And it wasn't just because of me, but collectively as a group of many voices at our State House, we're able to have legislation passed, right? That maybe then you'll have sexual health education that is age appropriate and medically accurate in all of the schools in Massachusetts, for example, or that you'll be a part of ensuring that in my town, all public buildings, all the restrooms in public buildings will have free menstrual products. and passing legislation. So as I get a little bit better, I'm still not completely comfortable with it yet. We're on Zoom, so it's okay. You can't see me sweating. But to step outside of myself and to know that I'm doing something for more than just me, and that we need to be a voice. And it's scary, don't get me wrong. But already just from watching your trailer and the introduction and hearing about all of the different leaders that you have in your organization, you probably don't need any convincing on my part to go out there and be leaders, because I mean, at least half of you are already.
Well, that's so nicely said. And what you've recounted about your experience already is going to resonate with so many of our students. We've got almost 600 public health majors here at Cal State LA, plus another 50 master's level students, and many of them are first generation college students. Many of them are caretakers in their family. Many of them are raising a family. And so, but yet they want to be deeply involved in public health and making a difference. Maybe I could just probe a little bit further about something you said, which is, you started, you had showed up and given testimony at before the legislature. I think this was in Massachusetts. How did you even take the first step to do something like that? Because to me, it sounds like that was one of your first steps. But for many of us, that seems like just like a humongous leap. Were there steps maybe before that you took? Yeah.
Oh, totally. I mean, it's not like one day I land in the state house. That would be pretty impressive on my part, but not at all. I think it started really within my own town and in my own community. I was just a really involved neighbor. I live in Brookline, which is right borders with Boston. And I live in a row house, so my neighbors can hear when my kids are screaming. And the good thing is it's winter now, so the windows are shut. But normally I'm embarrassed. And then I found out across the alley in the back, another neighbor was like, "Oh yeah, I can totally hear you when you're outside." And I was like, oh. But we're a very close-knit community. And everyone is really, not everyone, we're like every other city in town, but a lot of us are really trying to help each other out. It's a very affluent town, but at the same time, huge disparities. 13% of my town lives in poverty, and we have 3 food pantry sites. But at the same time, the owner of the Patriots football team also lives in my town. So it's the craziest disparity. And I joke, a friend had said it, and I believe it too. She said, we're like ginger ale families living in a champagne town. And it's so true. We're constantly I'm getting hand-me-down clothes for my kids from someone else's kids and passing them on and things like that. So my front porch is just, constantly, I have a little free library out front. We're all trying to help each other out here. And at the time, I was volunteering in different places within my town. And I realized that I wanted to volunteer looking at helping in particular women and children. Because as we also know, gender inequity is still real. I mean, goodness gracious, the attacks on reproductive rights are, the fact that my daughter now, who just turned 8, will grow up with less reproductive rights than I did is kind of sort of mind-boggling to me, but this is where we are. So I started volunteering, and I was on the Commission for Women. I got appointed. It's a really fancy name, Commission for Women, but it's really just a group of women in town who got together once a month, and we would plan a number of different things, whether it was getting winter coats for families in the winter who needed them, clothing for children, or holding symposiums on breast cancer awareness or whatever. And then it got to us realizing we needed to speak out at the state house and at our local legislature and other places to let people know that women and children matter, especially in policy making. And so that was one small part of getting me sort of used to doing things like that. And then as I was doing that, I realized you know, these people, these legislators, these Congress people, these senators, these representatives, they're people too. And while some of them I'm still very intimidated by, you know, I realize they're really working for us, right? And the state house is actually my house, so I shouldn't be worried about going in and meeting with folks. And then I also started to realize that, especially if it's your representative or senator in where you live, they will want to talk to you because you vote, you live in their town, they need to answer your emails and your phone calls. And I've gotten to the point where now I regularly reach out to them. And I see them as people, and I want them to also see me as a trusted resource if I can be of help in different areas. So my thing was to realize that your voice, and in particular, your lived experience, matters. People need to know what families are going through so that they can set policies and make laws that will really affect positive change. And I very often like to share my views with my elected officials. And I feel if they don't know who you are or your name, then shame on us, right? Because that's the only way we're going to make change, honestly. Voting, letting them know that you vote, and holding them accountable too.
That makes a lot of sense. And that, you know, what you did is you just sort of humanized, like what we often refer to as like our elected officials. It kind of seems like this thing that's very distant, and they have, you know, like powers that are, you know, that the rest of us don't have. You know, I've run into my own congressperson. I participated in like the homeless count here in Los Angeles. He always just shows up. He's a quiet gentleman who just participates in the count and doesn't come with an entourage or anything. But it's really funny because you can grab his, you know, ear for a few minutes and talk about things. But even I feel sort of nervous, and I try to make a point of doing this, of showing up to his office kind of regularly just to check in and offer myself as a resource. But, you know, you kind of, I feel like I'm not expert enough to really give some input. But what I heard you to say, and you can tell me if I'm right, is that, you know, your own lived experience is maybe expert enough. And just showing up to an elected official's office could be your way of having some leadership there, like you taking the lead and trying to make some changes by explaining your background, what you were describing as what women and children need, or what you and your family needs, or your community needs. Is that kind of what I'm catching on to?
Yeah, and what's funny is, so for my dissertation for my PhD, I don't know how it happened, but my PhD is actually in political science, but it needed to be related to public health because that was really my jam. So I ended up, for my research project, saying I'm going to interview all of these legislators, all of these elected officials at my state house. And that was like exposure therapy or something for me, and having to get over it. So I did. I ended up, you know, just sitting down with them or their staff and interviewing them, and realizing they are just regular fun people too. You know, to the point where, like, at one point I was pregnant and they were very kind, you know, if I need to take a break. And one day, literally, I was about to go in and do a whole slate of interviews for my dissertation, but I went into labor. So in between contractions, I'm like messaging, saying, you know, I'm so sorry, dear Representative so-and-so, Senator so-and-so, can I reschedule? I'm going into labor. Everyone was obviously very nice, like, no worries. And my husband, meanwhile, was like, get off the computer. The contractions are 7 minutes apart. Like, we need to get out of the house. Like, and I said, okay. So then later, when I had what was my second child, I ended up going back and doing the interviews. They were so nice. Some of them would just hold my baby for me while I did it, you know, and if there was a poopy diaper, I was just changing them on the tables and they were fine with it. They were really, like, I think we have to realize they are all people too, dealing with the same set of circumstances that we are. And yeah, they look polished and great on TV and things like that. But they are also very much people too, who are all dealing with the same thing, who have very similar likes and dislikes. You know, I have one person I know who loves ice cream. So whenever we see her, like she's happy to campaign anywhere that has ice cream. Right. So just try to realize that they are people too, but that they need to hear what you and your community is going through. Because otherwise they don't. They're going to be listening to this very loud minority of people. Because there's tons of research out there that show that, for example, as a nation, we believe in reproductive rights. We believe in all these things, yet people are passing legislation that doesn't match up with that because we're not making our voices heard. And that's part of the problem with public health. We're like sort of a silent ninja. Things go well. It was like, you know, your trailer, you know, you brush your teeth in the morning, things are great, your water's good. Nobody realizes public health, right? But it's really all because of that.
You know, this seems like a perfect way to transition to letting you maybe talk a little bit about your APHA kind of like, I guess you would call it a platform. Really what you're trying to help promote for our profession, which I thought was just fascinating. You had a 3-part agenda, if I remember right: play, read, and vote. And
so I
was
really excited to talk to you, especially since you're essentially a book club. This is like the marriage of my library / public health worlds like colliding. So I was just excited to hear from your Professor Stevens. And so I'm going to be totally honest, did not think I was going to win an election and become APHA president. Because if you look at the past 150 years, nobody looks like me. Nobody sounds like me. It's pretty like wild. So I didn't think I would win. And then all of a sudden when I did win, they said, well, what do you want to do for the year? And I said, well, I don't know. Because I never thought this would actually happen. But then I took some time and reflected, and I have 3 kids. I love things in 3s. I only have 2 puppies now, but we're working on it. My husband is, we're working on him. But I like things in 3s. And so I also realized that I wanted to do for public health what I need public health to do for our nation, which is to be silent no more, right? To let people know that we're important and in what ways we are and how much more power you have in public health to have such infinitely healthier societies. Like we really need to harness our power to understand that. And there are so many things we can do it, but how do you reach your layperson? So I don't know about you, like someone said, oh, representing the API community. So my parents still kind of like don't quite get the public health until we had the pandemic. And then they were like, oh, public health, that's Chris. And I was like, oh, goodness. And then everybody I knew became an epidemiologist. And I was like, wait, what? Like people, you know, your neighbor who has nothing to do with public health would be like, Chris, let me share some wastewater data with you and all this other new research. And I would just be gobsmacked because I would just be like, wait, what? Like, hold on. So, you know, everybody kind of didn't realize what public health was until we had the pandemic, which in some way is a silver lining. But at the same time, I think our memories are really short. All of a sudden now people are like ready to be done with the pandemic, moving on, and we're going back to normal, which is terrible. Normal was not good. I don't want us to go back to normal. Normal was not good for most people. We need to really change. We need a new normal. We need to learn our lessons so we don't get back into a new pandemic very quickly. But we need to make sure that everyone, not just all of you smart folks and people in public health programs know what public health is, but that everybody knows what public health is, that your mechanic knows what public health is, that the accountant knows what public health is, and that they know that everyone is a part of public health. So my efforts are going to be pushing in 3 ways. One is to play for health. Mainly I want, and this was really more looking at the public health community, but really all communities in general. I don't know about all of you all, but this last couple of years has been really rough. And I don't know if people, you know, I think at least my public health colleagues, they would work 24/7 and then some. Like they're working all day at their day job, then they come home and they're, disinfecting and working some more and helping their communities. Like no one's getting a break, no one's playing, and no one's taking time for themselves. And that is a real problem for your physical and mental and emotional health, but also people aren't playing and hanging out and being with others. So then you have the cumulative effects of social isolation and your lack of social connectedness. And you can see that that is having huge traumatic effects on, in particular, children and adolescents as well as older adults. So I want to get us back to playing, and play could be any number of things. It could be going for a walk. It could be hanging out with your puppy. It could be knitting. I just can't get knitting down, but it could be knitting. It could be, doing a puzzle. It just something fun, because I realized that what I was doing, which was not fun, which was doom scrolling on my phone while I lay in bed at night before I go to bed. And then that was the first thing I did in the morning. And that is crushing for your mental health. So don't do that. So, right. Like it was so much better if we played. And then also because I wanted you to get out there and do things with other people. And then all of a sudden there's this new thing called pickleball, which I very recently heard of. And I had never heard about this word pickleball before.
It's taking Los Angeles by storm right now. It's everywhere. Yeah.
Yeah. Like I didn't even know it existed. And then I just saw an article that there are pickleball dresses. And I am just like, I don't know, where was I? But I don't think pickleball was a thing when I was little. I don't even know. But you have to go out and you have to do it with folks, right? And I want you to go out and meet with other people. Since I've gotten a puppy, I have met a whole group of new dog people folks, and they're super lovely. Although I don't know anyone's real name. I just know them as their dog's, mom or dad or whatever. But really get out there, be with others, learn to get play back in, because we're not taking that time for ourselves. And that's one of my hopes. The other is to read for health. And a lot of that comes from my library hat, which is that unfortunately we have more challenges to book banning in public libraries and school libraries now than we have ever before. And if you look at all the people who are trying to ban the books that they're trying to ban are books by or for LGBTQ folks, marginalized populations, people of color. I mean, like it's terrifying, the types of books that people want to ban and censor. So I want us to get back to learning to read for health, to support reading, to support our libraries, and then also to learn how to critically read. I think part of the issue that we're still in this pandemic is misinformation, disinformation, fake news, and people are just like not understanding, what is evidence-based research, for example, and how to differentiate between that and maybe, a meme or whatever. And so I want to push us to read. I also think reading can also be fun. So that's why I loved that you're doing a book club. I think this is awesome. I love to read for fun and not just for betterment and public health knowledge, but I also have now realized that if I read a book for fun before I go to bed, that is far better than reading the New York Times. Because, oh my goodness, yes, it's just a world difference. And then you could also, and I know that Professor Stevens was saying you should read the book, but you could also do Audible or free. It's like Audible for free is Hoopla through your public library, which is basically audiobooks for free, and you can do those. And I like to listen to audiobooks when I go for walks too. So if you don't get a chance, oh yeah, Audible for the win, says Marissa. So if you don't get a chance to listen to Dr. Wen, to read Dr. Wen's book, you can listen to it, especially while you're commuting or walking and getting your steps in. That's my own thing. I hope it's okay and not cheating, Dr. Stevens. It's okay.
It's okay. I've been trying to push the free library versions of this book on folks too. So this is great. Wherever we get the information.
Yeah, however you get it. I also think it's kind of fun to listen to the author if they're the one that reads it. Sometimes the person who narrates it is not the author. And then when I run into the author, I'm like, you should have read it. That was weird. Because like for me, like it was a disconnect. Oh yeah, Ella, see, it has the audiobook. Everybody knows I love that you're using your library. And then my third is to vote for health, because let's be real here. We are not going to have any change in the conditions that affect our health. You're not going to have more affordable housing. You're not going to have anything that even approaches dealing with student debt. You're not going to have school meals or just any of these things, or zoning or whatever. All of this happens because of laws and policies that are made by your elected officials. So you need to vote for them or vote them out. Hold them accountable. You know, I love it when there's a contested election, because they are being held accountable. You know, there's a state rep in my town. I love him. He's a great guy. And he was recently challenged, and that was stressful for him because he thought he was a lock. But wow, his challenger made him realize that, you know what, for the next 2 years of he won his term, but he needs to work, because the next 2 years are not going to be easy. He's going to have another challenger if not. And that's what we need to do, is we need to vote. Please, I mean, definitely vote in your presidential election, but please do not vote only then. You have to vote at your very local level. In the pandemic, schools were opened and closed largely due to elected school committee members. Libraries open and closed largely. I voted as an elected library trustee whether or not our library would open, when and how it would open, whether you could pick up books or whatever it is. These decisions matter on a local level to people, and zoning, for example, or building an affordable housing complex, or renovating affordable housing, which needs the renovation. All of those, that is happening at your local level. It is the city council, it is the town council, county board of supervisors. It is all of, Marissa's like, oh, she knows this. So you hear what I'm saying. And then sort of like a 3, related to number 3, I'm asking you all, I want it so bad, is to run. Think about running for office. Part of my research when I was doing my PhD looked at whether or not, if elected officials had a health degree, whether it was social work, nursing, public health, or whatever, would their policy views and efforts be different? Yes, they would be. For example, I have a couple friends. One has a doctorate in public health, and she just ran for lieutenant governor. She came up short, but I don't think it's the last time she's going to run. But wouldn't it be great, instead of constantly going to your elected official and say, hey, you know what? Free fare buses would be a game changer for my community. Then people could get to doctors, offices, and school, and so many jobs and whatever. They could get to these things. It would really affect their livelihood and therefore their health. You don't need to convince them if they already know this, because they have this health background that you all already have. So I would love it if you ran for office. And I'm not saying, you should totally run for president. Like, I have heard of people who have never been in an elected office and ran and won for president, but that's like an anomaly usually. Feel free to run at your local level, right? Feel free to run, as I am an elected library trustee. I'm up for re-election in May. I have ran and won and been a town meeting member in my town for a dozen years. And a town meeting member in my town is a member of the town's legislature. So I was one of 245 people that voted on my town's budget. We determined how much money our schools would have, how much money, streetlights would have, how much money parks would have. I got to be a voice in voting for that. So if I can do it, and running locally is not pretty, I have cried in my minivan. People I'm Asian, I look young. I looked a lot younger over a dozen years ago. And people were not very nice when I ran, but to heck with them. I ran, you shake it off and you do it and you win. And it's so much sweeter when you do. So I'm hopeful all of you all will consider running. And if any of you do run for office, please send me a message and say, hey, Chris, I heard you. I'm running for office now and I'm excited, and let me know where to donate to your campaign fund. It might only be $25, but public, but I want you to run. You know, we need more folks like each and every one of you.
I would love to see some of our students especially upon graduation, get that degree maybe first. And then
you don't have to though. I taught years ago at Northeastern University. We have a co-op program for undergraduates there. And one of my students, I was a TA, one of my students is from New Hampshire. He ran and became a state rep in his town in New Hampshire. And he was under 21 and was literally voting on legislation for things like alcohol and whatnot that was for over 21-year-olds. I thought it was amazing and wild. And he kind of did it for his co-op. So dude, you can run, you can win. Y'all know how to set up your website. You obviously know how to use technology. I mean, that's like 90% of running. So Alex, wherever you are, I want to hear from you. Connect with me. Let me know your campaign site. I want to contribute. You need to run. Okay. If I can do it, I swear to God, you can do it, Alex. And you know what? If you don't win, it's okay, because a lot of the times it's just getting your name out there and name recognition. And then the second time, it's a lot easier. And maybe you run for something bigger next time too.
Actually, now that I think about it, I mean, if you're in school, you've got an automatic network of people who would support you, right? You've got your classmates and you can spread the word through PHSA and beyond. Brenda, I'm looking at you. Daisy, Joed, right? This is great. Thank you for this. You know, we've got just a little bit more time for our conversation before we open it up to a full Q&A. You know, I'm wondering, you know, what, it seems like, you know, leadership would be a very serious undertaking. So running for office or running for a position, you know, I can imagine that there's a number of challenges you might like to describe to us, but also some of the joys of being in a leadership position. Do you want to talk about those things?
So first off, running for office, when I first started running for office years ago, and I did it when I was in grad school, I was terrified. You had to like shake hands with people. The good thing about COVID is I don't have to shake hands anymore. But you know, you have to knock on doors and just, you know, so non-citizens, someone asked a question if non-citizens can run for office. So that depends on your city and town. So like, for example, in my town, you could, but in others, you might not. So that's something to check out, just to put out there. But you can help someone run for office. You can be on their campaign. You can knock on those doors. You can watch their kid. You can, you know, stuff the envelopes and do all these things. So there's a place and space for everyone, because I have some good friends who are like, I'm never running for office, but I'm happy to do your website, you know, and so you can do that. But I will say in the beginning, I was really terrified and nervous. Like, I mean, I just that's because we, you know, my family is like, we're quiet, we keep our head down, we do our job, like we don't get out there and stand up. And so it was hard, but I started to do it. And I started to realize that honestly, I would say only now, most recently in this last campaign for president of APHA, did I realize that trying to find the joy in this run, trying to find the joy in anything and everything that you're doing, actually, honestly, whether it's class or your work, savor the moments, right? Time is short, trust me. It goes by a lot faster, but enjoy it. So then as I started to understand how to run for office, I started to just have fun with it. I love making puns. I like designing cards to hand out to people. I like playing with Canva or whatever. So just enjoy that experience and just see where it takes you. When I ran for APHA president, I said, you know what? I'm going to run with my family. My kids, I had them help me make videos. My kids are now 8, 11, and 12. Help me make videos, you know, help me do things and just enjoy that experience and just be your authentic self, which is really hard because my authentic self is pretty much a hot mess. Like I've like COVID this past week. I did take a shower for all of you. But you know, I'm full disclosure wearing pajama bottoms because we're on Zoom. But I have the APHA vest on. But I decided, you know what, you just have to be who you are, and enjoy that campaigning. Enjoy connecting and meeting with people. Through campaigning, I have made some of the best friendships of my life. People who we text with, if something goes wrong, like they're right there. You can meet so many people. You have no idea. Your best friend could be out there right now. And so just really try to enjoy it. Truly. And someone else put in Ignite National. That's a great organization. I actually think I spoke with someone from Ignite recently or something like that at another university. So that's really great. There's a lot of good programs out there that are nonpartisan to run with, or consider, like, let's say you're not quite used to it yet, reach out to your local League of Women Voters. They're nonpartisan. And I guarantee you they would be happy to take any one of you, because what's happening with a lot of nonpartisan organizations is their membership is aging out and they're feeling really stressed and they want to get new energy. They also want these technical skills like the video that you made or the newsletters or the emails or all these things you can do. Like, they want that. I mean, you could very soon probably be, the board president for a League of Women Voters in your town. I truly believe that, because I'm also on the board of my League of Women Voters in my town. And it was just because I handled social media for them for a while, and so there are skills that you have and you can do it, and people want to hear from you. And they want to know how to affect change, and what change is needed.
Well, I think this strikes me as like the perfect time to open this up to a Q&A session. I think we'll hand it over maybe to PHSA to lead. Dr. Chanyasulkit, this is great. This is a good warm up, and I know there's going to be a lot of back and forth here. So we will switch over to that. Who from PHSA is going to lead this?
I could start with the first question because I'm really curious.
Sure. And feel free to ask me anything. It's an AMA.
Okay, I don't know, maybe just because some of us are undergrad. So do you have any advice for public health students who may not know what they want to pursue? Like, how do you find?
Totally. I still don't know what I want to do when I grow up yet. Like, I'm going to be totally honest. I love learning. It's ridiculous. Like, I'm like, you wouldn't even believe the random things that I'm doing these days. So it's okay. It's okay that you don't know what you want to do today, because really, I was there. Chill out. It's going to be okay. Enjoy the classes that you're in right now. Enjoy it, savor it, just really dig into it and continue to do what finds joy. And that may lead you down a certain career path. Or let's say you do an internship and you're like, that stunk. Then at least that's not what you want to do, right? Sometimes those experiences are just as good. So for example, for me, blood dissection, that's a problem. So medical school wasn't an option, right? So it's okay. But I will say, and I don't just say this because I'm president of APHA. Honestly, I say this because it has truly made a difference in my life. I joined APHA as a student, and you can join now as a student member. Perhaps the chair of your department will gift y'all some student memberships, maybe. And the return on investment will be amazing, because maybe the next president of APHA is from this cohort here. So for me, I joined as a student member. And in APHA, there are sections and places where you can find a home. Because public health is huge. Public health is everything. Public health is water, it's food inspections, it's swimming pool inspections, it's veterinary medicine, it's reproductive health, it's health policy and management. I mean, it's everything. But in APHA, they have different sections on different things, and you can go to all of them. You can join a number of them, and then you can meet people and volunteer in those places and learn. And that's what I did. I was a student member, and then I got involved. I was a student member, and somehow I was like, well, let's volunteer. And I would be on the education board because I'm a student in education, learning in education. Why not just try to join the education board? And I did. And I got on the education board, and then I think later, just because of an interest in technology, not because I had an interest in it, but just because of things I did, I became the board vice chair, then the board chair. And then it progressed through other leadership positions, leading me to where I am now. But I will say all of this learning and figuring it out and being a student and having APHA supporting me was great, because not only did I have my faculty and my professors and my classmates who were there, but it was nice to have this other professional network, maybe with other professors and other APHA students at other institutions who were kind of thinking and going through similar things, maybe, or maybe different things, and you could bounce ideas off of them. And for me, that has made a world of difference in all the things that I've been able to do and learn and embrace. So I would not stress yet. You're an undergraduate. Don't worry. You've got a lot of time. Enjoy what you're doing and do it well. And use this time to be curious and to keep figuring it out, because so much will change. And also just so much will change that what you do today might not be the same thing, a process that's even done, 10 years from now. So you as a public health professional will just have to innovate and change as well. So don't limit yourself, and don't put this undue burden of figuring out the rest of your life tonight. Because you're at Cal State, there's a lot to learn, a lot of great people to do it with. And then also you're probably going to need to run for office soon anyways. So then you can be a jack of all trades. Thank you, Brenda.
Thank you so much. That was very helpful. And you're so motivating and inspiring. So thank you so much.
I don't know. You didn't talk to my kids. No one's cleaning their room. Mess. Next question.
Well, okay, looks like I'm going to organize this. Dr. Zellman, I see a hand up. And then
Hi.
Alex Kirchner after this.
My hand is always up. Unfortunately, we don't have enough money to get all our students to come to APHA conferences. But when we did this a few years ago, it was in San Diego. They had a fabulous time. They learned a lot. They came back enthusiastic. So anything you could do to enable students like ours, most of them come from low-income backgrounds, Pell Grants, first generation, all those things. They would love to go to conferences, or even maybe just local, statewide APHA kinds of conferences. Anything we could do to help them out would be great. And I promise we'll do everything we can on our end to help out, but our resources are limited.
Professor Zellman, I'm looking at you. So I love this. So first, I think just giving everyone an APHA membership would be amazing. Student memberships are much cheaper than actually conference registration and the hotel and the airfare and all that, because we do so much online right now. And then we also do so much online just for students and just for early career professionals as well. And I know this because I think I'm scheduled to do I've done a number and I'm scheduled to do many more throughout this year. So those are great opportunities for students and others to interact virtually. And once you've joined and you have your membership, all of those webinars and virtual gatherings are included in the price. They also have great opportunities for practice interviewing and things like that, job interviewing through APHA, and they have a career mart as well as a discount on books, and you get the newspaper and all these other good things. So that's one thing that's really helpful. Then the second thing I will say is also to consider joining your California Public Health Association, which is like your local affiliate. There are 2 in California, I believe. And so if you're a member of those will also be likely even cheaper for registration, for membership. And they usually will also have an annual conference as well. So that's 2 things. The other thing I will say is my parents didn't even really know what conferences were like. So, and yeah, I was first generation, like I was cleaning people's houses when I was in college. So I totally get it. But I joined APHA and I applied. They have scholarships. If you do if you check through the APHA Student Assembly information, there's a lot of leadership positions and scholarships that are offered, whether it's for the annual meeting or we have a policy institute in June. And it's usually something like the student goes and, has to write up a 1-page paper report afterwards saying like, okay, oh, Patricia, you got what? Patricia, where are you, Patricia? Speak up, tell us what you got. Sorry, I'm just gonna
Hi, good afternoon, everyone. I just got back at 3 a.m. today from the Climate Communications Boot Camp that was organized by APHA, and I'm very, very thankful because it did train us to be, better advocates, especially as public health individuals. They really kind of like made us realize that we play a very, very crucial and important role, especially in all the policies that are, being debated today or at this moment. I also had the chance to go to visit some legislators yesterday, Senator Feinstein, Representative Lee, as well as someone, oh my God, I'm blanking out, someone from Orange County. So I was able to air out my opinion in regards to climate health and how it intersects with health and social determinants of health and all those good things. So thank you so much, I appreciate it for that.
Oh my gosh. So she's not even a plant. I have never met Patricia before. And that was amazing. So thank you, Patricia. But yeah, that's what I'm saying is like, you can get involved. It's not just the annual meeting once a year. It's really not just that. That is great. And I actually personally, aside from all the great research that happens there, I love just going and seeing friends and connecting and enjoying all the fun activities that happen. I think of it as my public health family reunion. But there's a lot that happens throughout the year. And then Diana even said the Southern California Public Health Association is only $10 for students. I think Professor Zalman, we can support that. But yeah, there's a lot of opportunities. I really encourage folks to think about that because I attended APHA annual meetings as a student because of scholarships and funding that I would find as well. I will put it out there. And then, and others of it was me eating granola bars that I brought, to save money and going to the free receptions and eating all the hors d'oeuvres for dinner because I was a postgraduate student. So I get it.
Those free meals, they matter so much, don't
so
they? Much. Alex, I know you've been super patient with your hand waiting. I want to give you a chance to ask your question too.
No, good. I'm enjoying listening to everything. You kind of already spoke about this, so maybe continue expanding on it. But what are your recommendations for people who would like to grow and maintain a network in public health, but in a way to do it that's also authentic? Because I think it can be very easy to just want to snag a bunch of numbers or connect on LinkedIn, but that's not really a genuine connection when you're talking about anything to do with public health or just career stuff in general. So what are your recommendations for doing that?
That's really good. And so one thing I will say is also, if anyone wants to connect with me on LinkedIn, that's super great, but please don't just send like a connect, just can you remind me, oh, I saw you at the Cal State Book Club or something like that, because otherwise I'm getting other really strange things from single men and it's very weird. So that have nothing to do with public health. So I would just also, if you're ever trying to link in requests with anyone, to share why and how you want to connect with them. Where did you meet them and things like that. The other thing is, and I love that you said that, like, be authentic, be yourself, make this connection, be real. Oh, Dr. Alvarez is totally getting that too. It is really kind of freaking me out, right, Dr. Alvarez? So you know, there are some people who I have met who are like, I don't know if you all know Kamara Phyllis Jones. She is a past APHA president. She is like a goddess among gods. And people are like, oh, wow, she was APHA president. I'm like, yeah, no, that I'm not like that. Like, I will never, like, she's too amazing, right? But I've gotten to the point where I was actually able to sit with her on a board doing work and then just connecting with her on, you know, talking about our family, our lives, things that were not in public health, and finding out what interests us otherwise as well, and that what brought us to this place in space. And then, for example, naturally over time with folks that you meet, whether it's in public health or, you know, medicine or wherever you're working in, right? You'll start to develop relationships with people, and some will just stick. I will say you'll meet those folks that you have a connection with. You know, you'll go to that conference or you'll go to this meeting, and then afterwards you're like, that was really fun, or, you know, she and I laughed at the same jokes, or, you know, oh, let's go get a bubble tea, and like, you know, you just will talk to people, and then they become just people that you really connect with. So now I have a great group of public health folks, like really amazing scholars, so much smarter than I would will ever be. But at the same time, I know I can turn to them for actual public health questions and things that I might be ruminating on. But also we can text and say, oh, did you get those concert tickets? You know, or whatever, or, you know, darn that Ticketmaster, or whatever it is, right? Or, you know, we can say happy Valentine's Day or happy Galentine's Day, you know. And I say this because I say, just be yourself, because I suffer greatly from imposter syndrome and I have to get over it, because don't ever do this. I remember my first APHA conference, I wore heels. I tried to dress nice. The conference is always at such a big convention center. I don't even wear heels in real life. So I don't know why I thought I could walk anywhere in heels, let alone a convention center. That was a terrible, terrible idea. And every time I've tried to be something that I thought I should be, it has not worked out well. No, literally, I also recently wore heels again and I almost fell off a stage. And I was like, I can't do this. Like, why do I think I can do this? So just be who you are, and people will want to be, the people that want to be with you are the people that are your that will be your chosen family. And I say this because I am who I am. You know, I will tell people, like, I love drinking bubble tea. I'm a super Disney fanatic, and, you know, this and that. I love reading mysteries, you know, I just, you know, and that's not for everyone. But you'll end up finding sort of your tribe and your friends that you're really close with, and they'll accept you for who you are, and you don't need to put on any airs anymore. Like now, if you go to an APHA conference, you might see me wearing Birkenstocks, because those are so much more easier for me to walk in, and less dangerous for everyone. And so honestly, I think if you are yourself, people will connect with who you are. And Alex, I think that's also something that's really important for when you run for office. Don't try to be the senator that you think Senator Kirshner should be, right? Like, folks will see through that.
Thank you. And I'm still debating if I want to run for office, but I appreciate it.
Just do it. It's like Nike, just do it.
I think your decision's been made for you. This is a lot of pressure, but we'll see you in office, Senator Kirshner. Thanks for your question. Anybody else? Joed, yeah, one of our PHSA presidents, yeah.
Yeah, so thank you so much for all your insight. It's been really inspiring and motivating for, I'm sure, all of us. You mentioned earlier, sorry about the lighting. You mentioned earlier that you have a mini library in your community and you emphasize the importance of reading. And oddly enough, PHSA has the opportunity to have a mini library in our department. And it was actually funded by the APHA grant that we were lucky to have a few years ago. And do you have any tips on how to encourage the community to feel comfortable taking from the library, or have tips on how to get people to donate?
Yeah, so I have a little free library right out front of my house, and I love it. And I get to pretend I'm a librarian, and my unscientific statistics show that I have great circulation. But I will say I like to do fun things. So for example, like, at St. Patrick's Day, I will decorate my little free library with little leprechauns and 4-leaf clovers or whatever. Or you could do different things. You could wrap books for next year for Valentine's Day, and people could have a date with the book, a blind date with the book, and they don't know, you could just a little blurb about that book. But to make sure it's inviting and open, and I always like to fix it up, make sure it's all nice. And then you also want to take some things out, because sometimes people have left like socks, and I'm like, this is a little free library, like not socks. So you want to just like keep it in good order. But I love that you're doing that. And also to think about not only that, but to think about, if you don't mind, contacting APHA. They have an Eco Bookworms Club. So you could see about getting some of their books and putting it in there as well. And partnering with your local public library or the Cal State Library. I'm sure they would be happy to help as well. And then if you are registered with Little Free Library, you can always enter every month all these book giveaways. So every once in a while, like authors will just send me random books and I will put them in. So definitely, if you're registered with Little Free Library, you can do that. It's so much fun. I love watching people like check it out. And it's really sweet.
Yay, thank you so much. That was super helpful. We're excited for the library.
Hey, President Garbo.
And I think that's with Dr. Alvarez, correct? Yeah, I think it's going to be, in addition to just a book library, like a resource tool. I think you said this, Joanne, sorry, but there's going to be other resources in there for folks as well. It's great. Other questions?
You can ask me anything.
Yeah, Naomi, go for it.
I have a question. Do you have any advice in terms of balancing between your professional life and your personal life?
Yeah, so that's a really good question. And I am probably the worst person to ask, because there was a time, oh my gosh, Dr. Alvarez, you're going to have a menstrual product dispenser. I love it. And a little free pantry. Oh, yeah, I want to add like another little like pantry to my like library. Sorry, Naomi. I'm COVID fogged and all of that. But so Naomi, so I would say, I think for a while I tried to think I could do that. And there are a lot of great folks out there who do that, who have, their professional lives, their professional social media, their work, who they are, and then they go home and they have, their family life. For me, honestly, that's just not really been possible because of a lot of the things I do. I volunteer heavily in my community. So like if I'm dropping my kids off or picking them up from school or walking the dog, I will very likely run into someone who will also want to talk to me about something that has to deal with maybe zoning or pedestrian pathways or whatever it is. And so I really can't separate those parts for myself. And then for me, I also realized that it was just a lot of work for me to try to keep them all separate. So I've just decided I am all me. I am Chris, and you get what you get and you don't get upset. So, I have gone to meetings where I have nursed my babies. I have brought my children to them. when I got a new puppy and we're all on Zoom, my puppies would appear, and people will just, you have to deal. If I've got to do something for an elder parent, I'll be honest and I'll just tell you, like, that is what it is, because this is my life. I had COVID this week. I'm just going to tell you what it is. Or, there are times when I have meetings and I'll be like, I'm just going to do this meeting while listening in the car because I'm actually commuting, because I'm also a mom and I've got carpool duty this afternoon. So it is what it is. So I really am not very good at talking about separating those things in that sense. I am fully, like, even my social media might be like a dog picture and a library picture and then something public health. And it is what it is. And I've just decided that I very much wish other folks in our world could also share more of who they really are. Because I think then together we can see that we have a lot more in common than we think. And there would be many more connections I think we could make. Because not until I started to just be who I am, did I have made so many great friendships now with so many amazing people all across this nation, because I let my guard down and I decided to be a little bit, less professional and just, share. And then also, I love, Professor Estrada said, a professional who was able to balance work and life properly. Yeah. And also, I don't think it's necessarily balance. And as a woman, you can't have it all at one time. You can have them at different times. And just stop with the whole, like, being super productive, having it all, leaning in until you fall off your chair. Like, take care of yourself, get some sleep, do what you can to make sure you're okay. Because if you're not okay, you can't take care of anyone else. And you can't dig in, you can't be curious, you can't learn, you can't support other communities, you can't raise up other voices, right? And just really, it took me a long time. I would say until 2020, I did not realize that. But realize that you don't need to have it all. You don't need to, let go of other people's expectations of you. Very hard. I truly only got that about 2021, this like 2 years ago. And I'm still working on it.
That's amazing that you got it. So
I don't know.
That's fantastic. Well, I know we're at the end of our time together, and it looks like there might be another question here, but I want to make sure, did PHSA have some things they wanted to do at the end of this as well?
We just have a few announcements, but it's gonna be really quick.
Okay.
Take the time. I don't need to go anywhere. My husband has got pizzas for the kids. I'm all done being mom today, so I'm all yours.
Okay, we'll go 5 more minutes then. Looks like Savannah has a question. And thank you, Dr. Chanyasulkit, for your time and your flexibility.
Hello. I just want to say thank you for all your inspiring words. The question that I have is, as you know, public health is all about collaboration. And as Dr. Zellman indicated, CalCIT is somewhat underfunded. Do you have any suggestions on how we might better support some departments on campus and successfully collaborating more with one another to better utilize available resources?
So I love this. And I will say, unfortunately, much of the examples that I have in doing that are really in partnerships at like the state or the local level, not necessarily within an academic setting, but I think they could apply. A lot of times, everybody is always trying to do maybe the same types of things, but they're doing them in their own little silos, in their own little worlds. And I started to realize that, a lot of public health can be delivered in libraries, for example, and a lot is being delivered in libraries. Like there are social services, there's naloxone. I mean, there's like trainings, there's everything that's being delivered in libraries. And libraries have some budgets, and there are actually some organizations, and I know this because I'm one of them, that grants libraries money that will do things on health and wellness, right? So you're just like, oh, okay. So it would be natural for a public health department to approach that. Or a lot of times recreation departments, for example, are a great place to collaborate with public health because it's health in all policies, or transportation, for example. We have a lot that happens in transportation in my town looking at pedestrian walk, bikes, paths, and all that, and alternative vehicles and things like that. All of that, they all have different types of funding. But if you can combine your resources, you can have an incredible amount of really strategic partnerships and programming that evolves from it. And you just really need to be innovative about it. And a lot of times, honestly, it just takes you, Savannah, talking, you know, I'm the public health person, but I'm going to go talk to this other person and to be like, what can we do? Because amazingly, my library and public health worlds collide when I became president. And all of a sudden I was like, well, I want to let's do something with this. And it turns out we have a National Library of Medicine and we have APHA, and they were here. But now they are partners working together on things. And we've sort of made that introduction because the National Library of Medicine reached out to me and said, hey, Chris, we got money. And I said, okay, let's talk, because I know how we can use the money. So, you know, so it's that way. It's not being shy, not being quiet. Ask. You're never going to get what you don't ask for. You know, that's the type of person I am, except for with my kids. I'm like, stop. But otherwise I'm like, ask, you know, there's no harm in asking. Or what's that other one that I like to do is, you know, apologize, say sorry later, and just do it. So maybe that's not very good though, because we're in class right now. So do that.
Thank you for that.
Good. Anybody else? Maybe a quick 2-minute segment here. Well, maybe in the meantime, I could ask, you know, what's a tradition as far as traditions can go in just a 2-year cycle here. But we take a picture together with our speakers. So if we could, I'm going to unpin us and maybe ask folks to turn on your background if you're comfortable doing that. Well, I'm going to remove your pin too. There we go. No, Savannah, I still get you. There we go. Okay. So if we could hold up your books as part of the book read as well. And I'm sorry, Dr. Chanyasulkit, we didn't send you a copy, but we can get one to you fast if you'd like one.
Awesome.
Good. Okay, so let's see. Let's see if we can fill up the whole screen with people with their pictures the best you can. And hold on one second. I open up the screenshot thing. Wow, doing this much video, my computer is going to catch fire.
Oh
no. Okay, hold on one second. Pause for it, wait for it. Oh, everybody looks so good. Oh my gosh, what a handsome crowd. Wonderful, but Jeanette, that's only Dr. Wen. We want to see you too. All right.
I'm not camera already, I'm sorry.
Okay, all right, no problem. All right, here we go. We'll take a couple of pictures. I think we got it, actually. That looks good. That looks good. Thank you, everybody. All right, you can turn your cameras back off. You can hide away.
But I love seeing you all. It's great.
Okay, I think this is a time for us to say thank you, Dr. Chanyasulkit, for all of your time and your insight. I know there's more we could talk about, and we could probably do it for a week. But thank you so much for being here. It means a lot to Cal State LA and to all of our students and our faculty. So we're thrilled.
Thank you so much to all of you. Again, if you want, feel free. Oh, let me just put my contact information in the chat. You can email me. I'm also on social media at Chanyasulkit, which is a very long last name. It's Thai. And feel free to contact me. If we ever see each other online, you know, just be like, hey, Cal State Book Club, you know, I'm ready. Or, you know, Alex, like when you're ready to campaign. And then also, if you do go to any APHA convening, whether it's a online one or an in-person one, please, if I'm there, just say hi. I would love to meet you in person. And if honestly, there's anything I can do to help you, because you are our future, right? You're amazing. I knew it from the moment I saw your trailer. Oh my goodness. And by the way, that trailer is the type of thing that they could do for your campaign, Alex. They're just really good skills. So yeah, I will see you all again soon. Take care. Thank you.
Thank